President Trump is teasing that later today he'll have a major announcement on autism.
I don't want to wait any longer. We don't need anything more. And if it's wrong, it's right. It's not going to be wrong. But if it is wrong, it's fine that we have to do it. Because we're going to have an announcement on autism.
We're going to be talking in the Oval Office in the White House about autism, how it happens, so we won't let it happen anymore.
I think it's going to be a very important news conference, and we want things to take effect immediately.
According to the Washington Post, the administration plans to raise concerns over pregnant women's use of acetaminophen, the active ingredient in Tylenol and other drugs, and the risk for autism. We should note Kenvue, the company that makes Tylenol, says there's no credible evidence linking acetaminophen to autism. Joining me now, Dr. Derek Cass, emergency medicine physician and former regional director at the Department of Health and Human Services. It's good to see you, Doctor. What are you going to be listening for with this announcement today?
Well, I'm going to be listening to what their evidence is, right? What is the evidence they're bringing to the community, to doctors, to claim that there is a risk to parents who take Tylenol in pregnancy for a later diagnosis of autism. I'm also going to be looking at what they put out on paper. What studies are they referencing? How are they evaluating those studies? I think it's more than just what they say at a press conference. What data they use to back it up?
So 4 individuals tell the Washington Post they plan to warn pregnant women against using Tylenol early on unless they have a fever. Just that guidance, would that be supported by science?
It is the current recommendation that the safest medication to treat fever and other ailments, if you need to take an anti-inflammatory and antipyretic, meaning a fever reducer, is Tylenol. I haven't seen any recommendations change from the American College of Obstetricians and Gynecologists. It's also true that risks like high fever, untreated inflammation can cause an increased risk for things like autism and other diagnoses. So I want to be really clear that recommending more caution is like just asking more questions, right? Decreasing the use of Tylenol in patients who need to be treated for their fevers or for other symptoms is not risk-free. So what the president just said about, well, if we're wrong, there's really no harm, like that isn't how we practice medicine in the United States.
Yeah, I'm going to say that again. What the president said is, if it's wrong, it's not going to be wrong, but if it's wrong, it's fine. We want things to take effect immediately. What is the net effect of that approach?
Well, I didn't think about it, right? These recommendations that they're putting out by first tweet or Truth Social, whatever it is, and then followed up by a press conference later and then some papers, cause chaos amongst the medical community and our patients because people don't know who to listen to and spent all this time trying to unpack misinformation when in fact there are pregnant people right now who have a fever or a headache and their physician has told them to take Tylenol and they're confused. And what I'm going to say to the American public right now is the recommendations have not changed from the scientific community. And that would be right now who I would take my guidance from.
So the administration apparently also plans to tout a lesser known drug called leucovorin as a potential autism treatment. Do we know much about this drug?
Yes, and we've known about it for a while, right? Leucovorin in patients who have a documented deficiency of a metabolic process and a receptor deficiency, they can respond very positively to the treatment with leucovorin for their symptoms related to their autism spectrum condition. And I think it's really important to remember that the specialists who take care of patients who have been diagnosed with any of beyond the autism spectrum have been getting this medication, and some have been remarkably successful. So it's a wonderful thing to have treatments for some patients who are qualified. But I certainly don't think we should be touting it as a miracle medication and give false hopes to patients who are not themselves qualified.
Dr. Derek Cass, always good to see you. Thank you. We will all be listening for that announcement.